Dear colleague, welcome. It's Dr. Jack, and I'd like to tell you about our 2019 Oasis Psychiatry Conference. Now, this is a new name, a new look, and an expanded editorial approach to a conference that we've held for the last 8 years, which is the Master Psych Conference. Let me tell you why we've rebranded. So every year, I speak with hundreds of psychiatrists and other mental health clinicians. And that's one of the blessings of my job, because I learned so much from these interactions. And no matter what the individual issues are that a clinician deals with day to day, it always seems to come down to two issues: that there's too much stress and too much frustration in our day-to-day lives, work lives. Now, the stress seems to be related most commonly to the sense that there's too little time to deal with the complex problems that our patients present with. And the frustration has to do with the same problems seem to occur in the clinic day after day. It's like Groundhog Day, different day, same problems. And you think, will this ever end? So when I thought about this, I thought, what are we doing about this as a profession? And I think the answer, unfortunately, is not enough. So then I thought, well, what can I and my team do? Now, obviously, we hold a lot of conferences, including what used to be the Master Psych Conference and now the Oasis Psychiatry Conference. And can we do something in this conference to address directly the sources of stress and frustration? And I believe that it is the right venue and that we can address those sources of stress and frustration. Now, it may seem that a conference may not be the right venue to address these issues, but I believe it's the perfect venue for the following reasons. When we're at a conference, we're all there together with hundreds of other fellow clinicians, right, who are probably dealing with many of the same issues, stresses, and frustrations that we are. So we can learn together, we can support each other, we can brainstorm, we can form mastermind groups, we can share ideas and solutions. We can also learn from faculty members and engage with them. So this is a huge mastermind group that could be a source of learning and support. Additionally, when we're at a conference, we get pulled out of the day-to-day hassles and bustle of our everyday work lives. So we have that space to kind of think bigger thoughts and look at the bigger picture, which is often very important. So the Oasis Psychiatry Conference is built on the following 5 elements. These are our expanded editorial guidelines. So number 1, the first element is we present psychiatric disorders and treatments. Now, this is the bread and butter of any psychiatric conference. There's nothing really new and unusual here. Our patients present with a major depression, with panic disorder, with OCD, with substance use, with ADHD, and so forth. And we have to know what the best assessment and treatment approaches are. And so we're going to take a master level look at these issues because, after all, we are not beginners. We're going to take a look at complex cases, and we're going to ensure that you get enough prescribing guidance so that if there's a new medication that you haven't used before, you have enough information to prescribe it effectively and safely. Now, element number 2, this is looking at the patient and their families holistically. After all, a lot of our sources of stress and frustration are not based on, do I choose medication A or medication B? It's based on the patient looked at holistically. A lot of patients are poorly adherent to treatment. They may act out in different disruptive ways. They may not keep appointments. They may not pay their bills. They may even be challenging, or even worse, bullying of us in our own clinics. Their families may work against our recommendations. So this is a very important element for addressing those sources of stress and frustration. The third element is looking at the clinic procedures. Now, this may sound dry and boring, but I guarantee you it is very, very interesting and very, very salient. In fact, from this presentation, which I'm giving, you may have the most take-home lessons that will actually lead you to make some changes in your clinic, whether you're in private practice or whether you're working in a group. So many of the problems that we confront working with patients in the clinic are based on problems in the clinic procedures themselves. And a lot of these problems could be completely eliminated, or if not eliminated, then nipped in the bud if we have the right procedures. So for example, what does your website say in order to already set the expectations, the correct expectations with prospective clients? Or what about the receptionist when someone calls to make an appointment? What does receptionist say in order to make expectations clear to that prospective client, so that if the fit is not right, maybe you never even see them. They look elsewhere. What about your forms? The treatment contract is an especially powerful form that will really set expectations correctly, and yet many people never even read it. When I was a resident at the University of Illinois, I never even read the treatment contracts that my patients would sign. When I finally did, I realized it had almost nothing to do with psychiatry. It had, it talked about, if you give biopsies are taken and what they do with the remaining tissue. Just a complete fail all around. Treatment contracts are very powerful, and I'm going to go into them in detail. And also, other ways of communicating with the patients. I'm going to give you sample scripts on how to talk with patients, again, to set clear expectations so that you don't have to then deal with the same problems over and over with that patient, so they know exactly what is expected of them and what you expect of yourself and they expect of you. Now, of course, that doesn't mean they have to adhere to those, but the consequences are already kind of thought out ahead of time, so that it's not like every time it's a new thing and we don't have to be reinventing the wheel every single day. Now, element number 4 is clinician career. Now, the job that you have today, it's unlikely going to be the same job that you have, for example, 5 years from now. I think it's very important to look at your career in totality, from today going forward to the time that you retire. And how do you have a career that is very meaningful for you, that at the end of your career you can look back and say, that was a great career. I really made great choices for myself. So we need to think about, does our job, our day-to-day activity, really align with our core life goals and with our core values? And also, what else can we anticipate may occur in life in subsequent years that we should be prepared for? And then element 5, this is clinician well-being. This is the broadest but perhaps most important element. So as part of this, we're going to have experiential training sessions. We're going to be doing yoga sessions. If you've never done yoga, this is your kind of safe place to try it out to see whether it's right for you or something that you could prescribe patients. And then I'm leading a couple of guided imagery sessions, which are very, very powerful, and I'd like to introduce them to you. So please take a look at our Oasis Psychiatry Conference webpage, everything here above and below me, and see whether the Oasis Psychiatry Conference is right for you. We're in an awesome place in La Jolla, California, within stone's throw of the ocean. You can see the sunset every day from the hotel courtyard and the hotel windows. So I hope you plan to join us. Please take a look, and rest assured that this conference, like every conference we have, has a better than money back guarantee. I want you to feel secure and safe in your investment of time and money when you come join us. And I hope you do plan on joining us. So this is Dr. Jack signing off. Take care of yourself. Bye for now.